I'm Dr. Rick Grummer, Professor Emeritus from the University of Wisconsin, and this is the Myth-Busting series from Biochem. All right, let's move on to myth number 2. All right, myth number 2. The best way to combat high blood NEFA is to inhibit fat mobilization. All right, we're going to cover this one pretty quickly. This is a quote by Dr. John Newbold. He was at a conference that I was at in 2004, and the proceedings were published in 2005 in a book. The title of his presentation was Liver Function in Dairy Cows, and this is what he writes in this book chapter. Nutritional restriction to adipose tissue mobilization, or in other words, fat mobilization from back of the cow, might be necessary, but there's a philosophical problem. We have selected cows that have increased reliance on mobilized body reserves as a source of nutrients for milk production. We just saw that data, right? That's a genetically superior cow. The farmer has paid the geneticist for this. Are we now going to ask him to pay the nutritionist to work in the opposite direction? We have our priorities wrong. We should explore what can be done to help the liver deal with mobilized fatty acids before considering whether we need to try to reduce the amount of fatty acid being supplied to the liver. All right? Says it, I think, very concisely and very profoundly. Diagrammatically, what's he saying? He said, historically, we've tried to block this process. But these NEFAs, they can be used directly by the mammary gland, or we know about 25 to 30% of them are taken up by the liver. Yeah, the downside is it could be stored as fat, or it could be partially oxidized and exported as beta-hydroxybutyrate. But that's if we don't have something called choline. And this is the thing that he says is how we should help the liver deal with these mobilized fatty acids. His approach is let the cow mobilize. Let the cow mobilize. But let's help the liver get that fat out into a particle called a very low density lipoprotein, which then can be used by the udder.